Hi, I'm Andy Loughlin from the Department of Family Medicine, and today we'll be reviewing the head, neck, eyes, ears, nose, and throat exams for the Practice of Medicine course. A number of the techniques that we cover today really aren't going to be presented to the students in their lectures until the spring semester, when they're going to be taught in concert with corresponding topics in the physiology and neuroscience courses. In addition, a lot of the techniques that we use today aren't going to be something that would be used in every exam that you would do. However, we want the students to be able to know how to do the exam techniques so that they'll have use of them when they need them. Okay, we're going to start with just the head and scalp exam. And like most things in physical diagnosis, we start with inspection, just looking for head and facial symmetry, patterns of hair growth, etc. I'm going to palpate the head and the scalp by moving the scalp tissue over the skull with my fingers. Okay. All right. Next, we'll move to the eye exam. And I'm going to start by having you look just right at my nose, please. I'm going to lower the lower lid so I can inspect the conjunctiva. Okay. And I'm going to turn the light up next to look for his pupillary reflexes, looking right at my nose. And I'm going to look both for the direct and the consensual response here, and do the same thing on the other side. Okay. Many of the techniques with the eye exam are things that are often also done along with the rest of the neurologic exam. I'm going to check the motion of your eyes. And you look right at my fingers and just follow them while keeping your head still. I'm going to go in an H pattern. Keep following my fingers as they come in and just look for accommodation. Okay, relax. Very good. Next, I'm going to do the ophthalmoscopic exam. I'm not going to dim the lights here so that you can see what I'm doing, but while you're practicing this in your group, you may want to dim the light enough so that the patient's pupils can dilate a little bit to make the exam easier. I'm going to dial the light intensity down on my ophthalmoscope so that the patient's pupils will constrict a little bit less. And I'm going to leave my glasses to the side. Those of you who wear glasses may find it easier not to wear your glasses so that you can get your eye closer to the lens on the ophthalmoscope. Okay. If you can find something that's at about your eye level, perhaps something right about there, I'm going to have a light that's going to be kind of bright in your eye. As best you can, just stare right past me. Okay. Okay. Now, I'm going to use my left hand here to both for my own proprioception and to steady the patient's head. Also, that way, if I bump into something, I'm going to bump into my thumb and not his eyebrow. And I'll get back here and check for his red reflex, and then gradually come in. And if I'm about 15 degrees from the midline, I should come in right in on his optic disc. And I'm going to trace the vessels back towards the disc, and then trace them out all 4 quadrants. Now just look at the light just for a minute. Okay. And I then do the same thing with the other eye. Okay. Next, I'm going to go through the lymph nodes of the head and neck region. And you can use any pattern you like with this. Just check for preauricular nodes and posterior auricular nodes. Moving back to the occipital area, down the posterior cervical chain behind the sternocleidomastoid muscle. Coming up to the anterior cervical or tonsillar area here, and checking the submandibular and submental areas, and finally down just anterior to the sternocleidomastoid muscle. And finally then, the supraclavicular area, just bend your chin forward a bit for me. Okay. That relaxes the muscles to hollow out the supraclavicular fossa for you a little bit. Okay, fine. I'm going to examine the thyroid gland in just a minute. First, I'm just going to look at the patient's trachea to see that it's midline, which it appears to be. And now I'm going to have you, if you can just rotate about 90 degrees this way. And I'm going to give you a glass of water to hold here. And I'm just going to check my landmarks first here, starting with the thyroid cartilage, and then coming down to feel the ring of cricoid cartilage right below it. And just below that, I think this is the isthmus of his thyroid. I'm going to have you take just a sip of water for me and feel if that indeed moves with. Okay, great. Now, if you could put some water in your mouth and just hold it there. There are a lot of different ways to examine the thyroid gland. We've picked one that's consistent with how it's presented in the textbook. And I'm going to come over laterally to the isthmus and go just behind, just in front of the sternocleidomastoid muscles on either side. Let me have you swallow. Okay. Now, to get more of a exam on one particular lobe, you may either move the trachea slightly out of the way, if I was going to try to examine his right lobe a little better, or pull the sternocleidomastoid muscle out of the way and do the exam the same way. Can you swallow one more time for me? Okay. Finally, I'll take this opportunity to examine his carotid arteries, since this is the region that I'm examining now. And coming over, starting at the thyroid cartilage. And over here, I'm going to palpate the carotid artery on this side. And if clinically indicated, you might listen here for a carotid bruit. Once I've found my location, I'm going to use the bell. Now, anytime it's comfortable for you, just take a breath in and then stop breathing. Okay, relax and breathe normally. Then I'd repeat the maneuver on the other side. Okay, next we'll move to the examination of the ears and hearing. And I'm going to move over this way and take this opportunity to inspect the ear, the skin, the structure of the cartilage. I'm going to take a look in the ear next. There are a lot of different ways that you can hold the otoscope, and all of these were presented to the students in the lecture. My personal favorite is to hold it like a pencil and keep the smallest two fingers of my hand over the temple area just to stabilize my hand. It's helpful to me, especially when examining a squirmy infant, but it can be helpful in adults too. I'm going to move the pen up and back just a little bit and look my way into the ear canal. Okay. This is, if you need to test hearing, this is an opportunity to do that. Let me have you cover your right ear for me and tell me what it is that I whisper here. 21. Good. Here I have my 256 hertz tuning fork, and I'm first going to do the Weber test and see whether his bone conduction lateralizes to either ear. I'm going to put this right in the middle of your forehead, and can you hear this more in either ear? No. Okay. Equally well. Okay. Next, I'm going to do the RINA, or Rene test, to compare air and bone conduction, and take the base of the tuning fork and put it over his mastoid process first. Can you hear that? Yes. Okay, tell me when the sound stops. Now, can you hear that? Yes. Okay, tell me when the sound stops. Yeah. Okay, great. And those periods of time should be roughly equal. Next, I'm going to examine the patient's nose. I'd like to see that each nostril is allowing air to flow through. If you could just, in turn, cover each side and breathe through to see that air moves through. Okay, very good. And I'm going to examine the inside lining of your nose now. There are special nasal specula that you can use, or you can also just use the widest ear speculum. I'm going to have you tip your head back. Now, this might tickle a little bit or make you sneeze. Okay. And I'm going to try and avoid touching the sensitive nasal septum. And do the same thing on the other side. Okay. Next, I'm going to examine the oral cavity. And I'll start by using the light to take a look at the oropharynx. Open up wide for me and say, ah. Okay. Now, he's able to depress his own tongue enough that I probably don't need the tongue depressor to see Well, let me try. If you put the tongue depressor about halfway back, say ah.
Ah.
Okay. This would also be your opportunity to test the gag reflex on the patient if that was something that you needed to do by just touching the tongue depressor towards the oropharynx. Okay. You can also use the tongue depressor or a gloved finger to examine the entire inside of the oral mucosa. I'm going to move your tongue out of the way on either side. Okay. Get your cheeks. Lift your tongue up to the roof of your mouth for me. Okay. Now bite down like E. Okay, that's the end of the session today for the head and neck exam.